Welcome to History Book. Imagine a world where hospitals were filthy, disease-ridden places, and soldiers wounded in battle had little hope of survival. Now, imagine a young woman, armed with nothing but compassion and a will to change the world, stepping into this darkness to bring light. This is the story of Florence Nightingale, the woman who revolutionized healthcare and became the founder of modern nursing. Stay with us as we journey through the incredible life of the Lady with the Lamp and discover how she forever changed the way we care for the sick and wounded. Florence Nightingale was born on May 12, 1820, in Florence, Italy, which is how she got her name. Her family was very wealthy and belonged to the upper class of society. Her father, William Edward Nightingale, was a landowner and a scholar, while her mother, Frances Nightingale, came from a family of merchants. Florence had one older sister, Parthenope. The Nightingale family lived in luxury, with homes in both England and Italy, and Florence was expected to live the life of a typical Victorian lady, attending social events, getting married, and managing a household. However, from a very young age, Florence felt that she was destined for something more. She was a bright and curious child, eager to learn about the world. Her father, who valued education, taught her various subjects, including history, philosophy, mathematics, and several languages. Florence was particularly interested in statistics, which would later play a crucial role in her work. As Florence grew older, she became increasingly aware of the suffering around her. She would often visit the poor in their homes, bringing them food, medicine, and comfort. Despite her family's disapproval, Florence felt a strong calling to serve others, and by the time she was a teenager, she knew that she wanted to dedicate her life to nursing. In the 19th century, nursing was not considered a respectable profession for women of Florence's social standing. Nurses were often untrained, and hospitals were filthy places where infections spread quickly, leading to high mortality rates. Despite these challenges, Florence was determined to follow her calling. She spent years studying healthcare and nursing practices, often in secret, as her family was strongly opposed to her chosen path. In 1849, at the age of 29, Florence finally convinced her parents to allow her to train as a nurse. She traveled to Germany, where she studied at the Lutheran Hospital in Kaiserswerth, a facility known for its progressive approach to healthcare. There, she learned about hygiene, patient care, and the importance of sanitation in preventing disease. Florence was a dedicated student, and she quickly realized that many of the deaths in hospitals were preventable with proper care and cleanliness. After completing her training in Germany, Florence returned to England and began working in a hospital in London. She quickly gained a reputation for her skill and dedication. Her approach to nursing was revolutionary. She emphasized the importance of cleanliness, good nutrition, and proper ventilation in hospitals. Florence also understood the importance of treating patients with kindness and compassion, something that was often lacking in hospitals at the time. In 1853, the Crimean War broke out between the British Empire and the Russian Empire. Reports soon reached England of the horrific conditions in the British military hospitals. Soldiers were dying not just from their wounds but from diseases like typhus, cholera, and dysentery, which spread rapidly in the unsanitary conditions. The British government was criticized for not providing adequate care for its soldiers, and the public demanded action. In response, Florence Nightingale was asked to lead a team of nurses to the front lines to help care for the wounded soldiers. In 1854, she set sail for Crimea with 38 nurses, most of whom were nuns. When they arrived at the main British hospital in Scutari, now part of Istanbul, Turkey, they were shocked by what they found. The hospital was overcrowded, dirty, and lacked basic supplies like bandages and soap. There were no proper toilets, and rats and insects infested the wards. Florence immediately set to work. She organized the nurses and assigned them specific tasks, such as cleaning the wards, washing the patients, and preparing nutritious meals. She also worked to improve the overall conditions of the hospital. She ordered the installation of proper ventilation systems, arranged for the removal of waste, and ensured that the soldiers had clean bedding. Florence believed that fresh air, cleanliness, and proper nutrition were essential for healing, and she did everything in her power to create a healthier environment for the soldiers. Despite facing resistance from the male doctors and military officials, Florence's efforts began to pay off. The mortality rate in the hospital dropped significantly, from 42% to just 2% in a matter of months. Florence became a beloved figure among the soldiers, who called her the Lady with the Lamp because of her habit of walking through the wards at night, checking on each patient. Florence's work in the Crimean War made her a national hero in Britain. She returned to England in 1856, where she was celebrated for her achievements. However, Florence was not interested in fame. She was determined to use her experience to reform healthcare. She wrote a detailed report on the conditions she had encountered in the military hospitals, which led to the establishment of the Royal Commission on the Health of the Army. Her recommendations, which included improvements in sanitation, nutrition, and medical care, were implemented in military hospitals across the British Empire. In 1757, Franklin was sent to London as a representative of the Pennsylvania Assembly to address grievances with the British government. He spent several years in England, where he gained a deep understanding of British politics and society. Despite his efforts to maintain good relations between the colonies and Britain, Franklin eventually realized that independence was the only viable option for the American colonies. Upon his return to America in 1775, Franklin was elected to the Second Continental Congress, where he played a crucial role in drafting the Declaration of Independence. As one of the 5 members of the committee, Franklin helped shape the document that would declare America's freedom from British rule. During the Revolutionary War, Franklin was sent to France as a diplomat to secure military and financial support for the American cause. His charm, wit, and intelligence made him incredibly popular in France, and he was successful in gaining the French alliance, which was instrumental in the American victory over Britain. After the war, Franklin continued to serve his country. He was a delegate to the Constitutional Convention in 1787, where he played a key role in shaping the United States Constitution. Although he was in his 80s and in poor health, Franklin's wisdom and experience were invaluable in the drafting of the nation's founding document. Franklin returned to Philadelphia in his later years, where he continued to be active in civic and intellectual pursuits. He became an outspoken advocate for the abolition of slavery, serving as president of the Pennsylvania Abolition Society and working tirelessly to end the practice of human bondage. Benjamin Franklin passed away on April 17, 1790, at the age of 84. His funeral was attended by thousands of people, a testament to the profound impact he had on his country and the world. Florence Nightingale passed away on August 13, 1910, at the age of 90. Her death was mourned by people all over the world. She left behind a legacy that continues to inspire nurses, healthcare professionals, and humanitarian workers to this day. Florence Nightingale is remembered not only as the founder of modern nursing but also as a pioneer of public health and medical statistics. Florence's life was one of service, dedication, and unwavering commitment to the well-being of others. Her work saved countless lives and transformed healthcare for the better. She showed the world that with determination, compassion, and a vision for change, one person can make a profound difference. The Lady with the Lamp continues to shine as a beacon of hope and a symbol of the power of kindness in the face of adversity. Thank you for joining us on this journey through the life of Florence Nightingale. If you were inspired by her incredible story and want to learn more about the remarkable individuals who have shaped our world, be sure to hit that like button and subscribe to our channel. Your support helps us bring more stories of history's greatest figures to life. Don't forget to ring the bell to stay updated with our latest videos.